All right, so I'm going to start with you guys in the back. I haven't heard much from you guys lately. So what I'd like to know is, one, what your thoughts are with this activity, and two, how different were your definitions at the back table?
I guess our thoughts were it kind of helped us to kind of really break things down because we often say aggressive behavior, but what does that really look like? So if you're sitting at a table with a parent and you're at an IEP and you talk about aggressive behaviors, well, what are you talking about? So we talked about a lot of different things: hitting, kicking, throwing objects, becoming physically aggressive, verbal or non-verbally, kind of saying things that may be inappropriate.
So how similar were your definitions when you went around the table? Did you all have pretty much the same definition, or was it different?
It was somewhat different, but somewhat in the same ballpark, I think. We're kind of in the ballpark, but we kind of said it in different terms, but it pretty much came out the same in terms of
Okay.
describing aggressive behaviors.
Would you use the same definition for each child?
Not necessarily, because every child is different and they kind of display different behaviors. So it helped us to really think about, we really need to break it down when we say aggressive behavior. What does it look like for that particular child, perhaps?
Good. I really like that. All of that is spot on. Let's see. How about you guys over here? What did you guys have?
Headbanging.
Headbanging? Okay.
And we talked. Oh, sorry. So we talked about our definitions. It was somewhat similar, as the lady over here said, kind of the same vein, but just describing it a little differently. But we also talked about, it's a way of, we talked about as a way of communicating their wants, their needs, perhaps some sensory issues that's going on. And we also talked about perhaps there may have been some change in medication, or the medication not particularly working for that particular person.
Okay,
As
so
a means of,
you guys did it a little bit different, because you guys mostly just described what the behavior looked like, and then you guys described what the behavior looked like, and then also talked about what some of the potential causes might be. Good. So what do you guys use behavioral definitions for? Has anybody, who's written a plan in here? How many people write plans? Okay, and how many people implement plans? Who's had to follow a behavior plan? Okay. So for those of you who follow behavior plans, have you ever taken a look at a behavior plan and had confusion as to what you were supposed to do on that behavior plan? Yeah? Okay, give me an example. Not necessarily us, like, don't tell us who the case is, but give us an example of one of the confusing parts of running a plan.
I don't know like a specific example, but if you try you might have one person that has the same behavior plan, but you have to do a completely different technique for it. I can't think of one off my head.
A different technique for, like, you have the same behavior plan for more than one kid, but
like
different.
in my other homes,
Okay.
I have like certain other people will have them, and you have to go a completely way. So that could be kind of confusing when you're so used to going a certain way with it, and then you can't use it this way because they don't, respond to it.
So when you get a behavior plan for a particular consumer that you're working with, do you normally get, like, whoever wrote the plan, do they sit down with you and they go over the plan, they do an in-service, and then do you guys talk about the behavioral definition at all?
So depending on who is in servicing.
Okay, all right. So one of the things that I find can be really difficult from our staff standpoint is, depending on how you write the behavioral definition, like, a lot of times people will just write aggressive behavior. Okay, so let's say I write aggressive behavior, and then let's say I have 3 staff people that work with that particular child. And my goal is to take baseline data. All right, who knows what baseline data is? Okay, so data, somebody shout it out. Baseline data is?
I don't know if it's like one word.
Okay, well, what is baseline data?
It's just a direct observation of a behavior set without manipulating any of the environmental factors.
Right, so you're taking data on what the behavior looks like before your intervention.
Starting point, I guess.
Yep, and then that tells us what? Why do we take baseline data? To see if it works, right? So if we implement a treatment, remember I talked about earlier, if we implement a treatment and it doesn't work, should we keep doing it? Probably not. So now let's go back to our original question. So we have baseline data. or we're taking baseline data on aggression. And our staff people are the ones that have to help take the baseline data, right? So now Susie, staff person 1, is taking aggression data based on maybe how it was defined on a different plan that she was working on. Joe comes in and he's taking aggression data, and he's never been trained on aggression. He's never worked with a child with aggression before. So maybe when he thinks aggression, he's thinking, well, if they even come near me and they kind of reach out towards me and they touch me, some of those lower level aggressive behaviors, if he's taking data on those things, he's going to get a much different number than if Susie's been trained on data collection for a very aggressive child and she's waiting for like a fist, or if she's waiting for a kick, or if she's waiting for some other kind of definition. Now that child's behavior on paper is going to look very, very different between those two staff people, right? So now let's say we haven't had a very good definition of the behavior. Now we have 2 different staff people that are observing pretty much the same behavior at the same rates, but they're reporting it at very different rates. What do? What tends to happen? And what does the person who's written the treatment plan do? Maybe they write another plan. They're like, this plan isn't working. What's going on with that? Something's not right.
I don't know what you're looking for. Sometimes I'll meet with both, and I'll say, well, what are you doing differently? Because you're getting these numbers, you're getting these numbers. So obviously they're both,
Yeah, so that's a really good thing to do as the person who's writing the treatment plan. How are you interpreting this, and how are you interpreting this?
How are you interacting versus how are you interacting?
Yeah, and that's another thing, and that's one of the pitfalls. If you don't have a really good definition, I might be going, hey, Susie's doing a great job. She's got way less behavior than you do, Joe. But maybe Susie and Joe have exactly the same behavior, but they're just tracking it differently. So that can be a huge problem. And if you don't have a really good definition of behavior, then you're going to have a really hard time identifying when it's occurring and when it's not occurring. So now your data's off. And if your data's off, do you know whether or not you're making progress? You don't, because you don't know if the behavior is increasing or decreasing, so you don't know if your plan's working. So maybe you'll ditch the plan because you think the plan's not working, where maybe the plan was working just fine. And now you've wasted more resources. Were you going to say something?
Yeah, I was going to say, could it be the case that the individual, the person you're working with, just has a different reaction with, say for instance, maybe you have a male staff that's working with them, and doing the exact same behavior plan as the female staff is doing with them, but the individual is only receptive to the female.
And that could be 100% correct, but if you're not taking the same data on the same responses, then you don't know if that's the cause or not. So the point of this exercise is to really think about how do you define behavior, not just so that it makes sense to the plan, but it has to make sense to the people who have to work the plan, who are implementing the plan, because you want to make sure that their data is as accurate as possible so you can make a better judgment call. Because if I don't know if my data's right, then I don't know where to start looking to solve the problem. I can't fix the problem if I can't measure the problem. Does that make sense to everybody? All right, so when we're defining behavior, we have to make what we call an operational definition. And basically, we're looking at ways to write the behavior so that it's recognizable by anybody who comes into contact with that person. We also need to be able to recognize when they're not supposed to take data, right? Because like, let's say you're taking data on repetitive questioning or something like a repetitive verbal behavior. There might be a time when it's okay to have echolalia. Can you guys think of a time when we defined echolalia? Can you guys think of a time when it might be okay, where it's not a problem behavior?
Like if he's learning or he or she's learning like a nursery rhyme in class or something, and say repeat it back to me.
Yeah, so if I ask you to repeat in order to memorize something, it's okay to have echolalia. So that's an important thing. You don't want to count that as problem behavior if it's acceptable behavior. What about when I what if I gave you a 3-step direction? What would you do?
I'm sure on what your definition, your 3 steps are.
Yeah, so
2 and 3.
yeah, so you're talking it out loud and you're going, okay, and now I'm supposed to put this away, and you're echoing the instruction. So there might be times when it's appropriate, and that's the case for all behaviors. Yelling and screaming is also sometimes appropriate, not all the times, but sometimes. So you have to think about when should the behavior be included, when should it not be included, and this leads us to reducing errors for treatment. So this is why we need to have a good definition. If you're implementing a plan and you don't understand, if you have to go back and ask what they mean by the definition and whether this is included or whether it isn't included, then that probably means that we need to expand the definition of the behavior. So that way anybody that picks up the plan, because the treatment plan should be a resource to you. It should be something that you can reflect back on and look at to make sure that you're doing the right thing. All right, so when you're thinking about documenting behavior, we're going to document it in different ways. Topography of behavior is what the behavior looks like. So everybody did a pretty good job at writing definitions of behavior that talked about what the behavior looks like. When we talk about what the behavior looks like, though, we don't add any of those causal factors. We don't add things like why. We just want to describe what the behavior looks like as we're taking our baseline data, as we're trying to define the behavior, because if we start to think about why, then that could change how people document about the behavior. So we really just want to put what it looks like. You guys know what frequency is? Somebody tell me what frequency is that hasn't talked a lot. How many times? Good. So I'm going to take data on every single time that the behavior occurs, and that's frequency. How about duration? How long it lasts. So I'm going to have a start time and I'm going to have an end time, and I'm going to want to know what the total time of behavior is. So that's duration data. What's magnitude data? Say it again. How bad it was. What's the severity of that behavior? Has anybody written a plan where they had to measure magnitude?
Scale of, like by pictures or on a scale of 1 to something.
Mm-hmm. Yeah, so
It's tricky. No, I'm sorry.
go ahead.
Sometimes like if his head cracks the drywall, it's really tough
Yeah.
to measure, certain things. You
Yeah.
have to be creative and-
If you are measuring magnitude or severity, you have to have really good definitions
Right.
of the behavior.
The skin.
Mm-hmm. And we've done that at our center. We have a couple of kids that had really bad tantrums, and we had tantrum 1, tantrum 2, and tantrum 3. And then we defined those based on property destruction, crying, duration, those kinds of things, because that particular measure was important. Has anybody used permanent product as a measure of behavior? Do you guys know what that is? Say it again. How it works, kind of. Usually permanent product is something that the person produces. So let's say we wanted to measure how many math problems they were able to complete in a 20-minute period, or whether or not they completed their entire task. Did they fold all of their laundry? Those are the kinds of things that would be permanent product, because you're not measuring something that's disappearing, you're measuring the end product when you're all done. And that can be a really nice way to measure behavior if you're looking for that kind of thing.